Bismillahirrahmanirrahim. Today is the topic about hysterectomy. Today is about the clinical. We will study the clinical aspects about the hysterectomy. The first of all, what is the hysterectomy? Hysterectomy is a surgical removal of the uterus. Okay. Now, what are the possible indications that we have to do hysterectomy? Why we do hysterectomy? Number one, may be due to heavy menstrual bleeding, or number two, it may be due to the pelvic pain or uterine prolapse. If uterine prolapse collapse with each other, like there's little space between them, so it is prescribed by the surgeon to do vaginal hysterectomy. And gynecological malignancy, usually ovarian, uterine, and cervical, risk reducing surgery, usually in cases of BRCA, 1 or 2 mutations, or the Lynch syndrome. We will study at the later about the Lynch syndrome. Now, what are the measures that how to do hysterectomy? The surgeon should be very clear concept about the region, anatomical region of the hysterectomy, because when a surgeon do hysterectomy, there is a complicated structures at the pelvic region. So if he does not know correct anatomy about the structure, so it can cause a damage to the other structure. So to prevent other structure to be damaged, the surgeon should be uh, a good knowledge about the regional anatomy. The uterine artery crosses the ureters approximately 1 centimeter laterally to the internal wall of the cervix. The relation between the ureter and the uterine artery is like a bridge, water under the bridge. Bridge is ureter and the sorry, water is ureter and the bridge is uterine artery. Why we say ureter, water? There's because ureter have urine inside, so water resembles with the urine, but the uterine artery is like a bridge-like structure. Okay.